I feel like I'm doing so much for my patients, but it's not showing in terms of outcomes. Why am I here? Why am I so incompetent? What's going on? Like, this is my place. I think, yes, this is my thing. This is what I want to be doing.
Hey guys, welcome to the CPD Junkie podcast, where we bring you interviews with dentists sharing their CPD stories and journeys from around Australia.
Greetings CPD Junkie fam, I'm your host Dr Laurence Doan, and today we're joined by Dr Emma Turner. Since having graduated from UWA, she's worked as a house dentist, initially in Melbourne's southeast and more recently in Darwin. In addition to her clinical interest in the management of patients with complex medical needs, craniofacial development abnormalities, dentofacial trauma, and oral pathology, she's passionate about research, having spent 2 months at the University of Utah investigating prenatal therapies for orofacial clefts, and having been involved with the molecular profiling of oral potentially malignant diseases or disorders while at UWA. Dr. Emma Turner, welcome to the show.
Thanks for having me, Laurence.
So, full disclosure to our listeners, Dr. Emma and I know each other through our ADSA days when I was vice president. She was the convention co-convener. So, please forgive me if I'm being a little bit informal, Dr. Emma. So, before we get started, Dr. Emma, tell us about what it's like moving across 3 states.
Oh, I guess I've kind of normalized it now. One of my friends made a joke that I need to change my life every 2 years, and that's probably not untrue. No, I think having been locked into 8 years of uni and like 12 years of school in WA, was very eager to see a little bit more of the world. And I think because when I was doing my undergrad, I had the opportunity to go on exchange to the UK. I kind of got a bit of a taste of life outside of the beautiful little Perth bubble. I know everyone kind of knocks it, but there is a lot going to Perth, and I've got like very gorgeous friends and family there, so I can't complain. But equally, I think I just was eager to get out and kind of work in other centres just to broaden my exposure to different ways of doing things and also just have a bit of life experience. So, although I think I didn't realise until my most recent move how decentralised everything is. Like, everyone needs a different working with children card, and like everyone has different number plates you have to switch over to. I think the minor logistical inconveniences definitely are outweighed by the excitement of moving to new jobs and to meeting new people. So, definitely worth it.
Yeah, because look, lots of recent graduates contemplate, whether to move interstate or because, they might not know many people there, Yeah,
I think as well, like the ADSA bubble and all the experiences that I'd had working and studying elsewhere have been very fundamental in giving me exposure to networks in other cities. So I think everywhere that I've moved, I've had a lovely kind of established network, even if just of a few people, that's made the transition pretty easy. So I think as long as you put effort into cultivating your friendships and maintaining connection with people, everyone's super friendly. Like, as soon as you kind of pop up in a city, everyone's like, oh, hello, coffee, let's do it. So, I think obviously it's hard initially, and kind of transitioning from meeting so many new people to solidifying your friendships and building a sustainable network in a new city is a tough one. But I think I've lucked out today.
No, that's good. That's good. Nothing like, losing your splint during the transition or trying to find a medical professional.
My article. Yeah. So we lost the splint, and then we cast it into the washing machine after my lovely orthodontist colleague offered to make me a hard soft one, and the soft liner warped. But it's okay. I've got a new splint now, so we're in business.
So, okay, let's dive into your CPD dental journey. So you graduate. So what happens when you graduate?
Oh, what happens when I graduate? I frantically threw my life into a suitcase and zoomed across to Melbourne. I think my first job I was incredibly lucky with. So basically in my final year, I had been put in touch with someone that's now one of my best friends, Laura Chen, and she was the dental reg at Monash at the time. And kind of within a 45-minute conversation with her on the phone in kind of March 2020 in the midst of lockdown, I was pretty sold on this job. And so I was very, very lucky to be given the position, because I know it's a bit of a tricky one. And so basically, like, got my life together, moved across to Melbourne, did 1,000 online mandatory training modules, my goodness, and then learned myself in this little clinic in Monash. And so for those of you that aren't familiar with the Monash kind of hospital situation, it's a tertiary hospital that has an adult and pediatric campus side by side, which was kind of the perfect case mix for me. I think I really enjoyed the combination of the trauma and the inpatient care and outpatient care, and we kind of popped up to theatre and zoomed across to ED when we got calls from them. So the gig was 1 in 2 on call, which during COVID was fine. It was actually really good. It gave me a lot of structure and opportunities to learn when I got there, because I think they were kind to me. They gave me a couple of days to settle in, and then I was holding the on-call phone. And I remember very vividly my first after-hours call. It was like a 6-monther that had a dental alveolar fracture and kind of buccally luxated, 7-1, and had to extract that in ED, which was an interesting experience. So I was well and truly thrown in the deep end, but very well supported, because we had such a well-structured setup with input from, so we had 4 orthodontists, an endodontist that came once a month on a Friday, 2 training max backs regs, and also a couple of weekend on-call regs that we were always able to talk to. Lots of max backs consultants and oral med specialists. Oh my gosh, what have I forgotten? It's terrible. And 2 prosthodontists, one of whom has very happily retired now. But we were so well supported in our in-hours commitments. And John, our dental consultant, who wears the special needs hat there, I don't think he sleeps. He's up with the birds, and if you ever had a call, he'd give him a buzz, and then 2 seconds later he'd pick up, wide awake, very helpful. So it was kind of this funny mix of being exceptionally well supported by very qualified, very patient and caring people, but then also just like having to navigate hospital land with a degree of handover, but I feel like that never fully prepares you for navigating the hospital system. Like, I came from UWA, which was a good course, but very much geared towards private practice. Like, I did 14 units of crown and bridge when I was there, but didn't do a single completely independent extraction other than on an external rotation that I organised myself. So yeah, going from that to a public hospital job was definitely an adjustment. And like, no one tells you how to organise an emergency theatre. Like, how do I call anaesthetics? Why do I call anaesthetics? What's happening? Like, so I think it was a very steep learning curve for the first couple of months, but settled in no time. And the first, so I was contracted for 1 year, and then you reapply to stay on as the dental reg for the second year. And I didn't have a doubt in my mind that that was the best decision for me, because the team and the scope and the variety and the learning was just exactly what I was yearning for when I finished. So I don't know if that answers your question, but yeah, it was a really amazing first year out, I think.
Yeah, I mean, let's unpack that a little bit. Obviously, so you said you've got this access to a lot of different specialists that are both dentally and non-dentally related. But like, I mean, if you're working there, you know, do you have a senior clinician that's, that you're working alongside who's also a dentist? Or, you know, when you're at emergency, you know, are you going in there by yourself, or there's another specialist there that's working with you?
Yeah, no. When we pop by ED, we take our little toolbox, little mirror, little torch, off we go.
Some things don't change at dental school, hey?
No, exactly. You've got to have that tackle box. So our consultant was always on call to support us, and we had to, in theory, run all of our decisions by him if we wanted to admit someone to the hospital, or if we wanted to take a patient to theatre. But because we're just so lucky to be supported by all the other medical teams as well. Like, by the end of my 2 years, I it was so hard to leave because you got to ED and you're like, oh my gosh, hi, how are you? Right, I'll see your patient. And then you're like, okay, yes, IV, Ben, Pen and Metro, please. It's our running joke that that's all we know how to say. Absolutely not true. We have good antimicrobial stewardship. But yeah, all the medical teams have to provide advice. There are so many people that you interact with along the way that provide guidance. And so I mean, there was not necessarily always someone physically there with us, but our manager, Sam Bailey, is the most beautiful person, and she was kind of like the mother hen and matriarch of that service. And so if there was no one physically there that was kind of a trained specialist in that area, she would, because she'd been there for 12 years and she ran a tight ship, she'd just be like, don't worry, like, you don't have to do treatment today. We'll rebook with this person. We'll get them in on this day. But in terms of the acute emergency stuff, we were really lucky because there was always one fresh grad dentist and then my registrar. So in my first year, I had 1 month with my beautiful friend Laura that I was talking about before, and then the rest of the year I spent with Brandon Lim, who is the most exceptional person. He'd come across from the Alfred, so was hospital trained, but also fresh to the Monash job when we started. So he was just so approachable, and we were kind of little buddies in it together. So he was always there to ask as well, with a little bit more experience. So there were always questions that could be asked and people that could help us.
Yeah, I mean, the other question is, like, people are afraid when you're in the hospital dentist, especially when you're, in such a, specialized kind of like field, right? Yeah. I mean, when people talk about courses, they talk about, just general dentistry, which is like crown bridges, like you said, endo and all that stuff. Like, how do you upskill, in this field?
Yeah, so I'd always joke our scope at the hospital kind of starts where the therapeutic guidelines end to an extent.
The clown book.
Yeah, the clown book. We love it, but also it was a funny kind of dichotomy between having, for instance, Friday mornings we'd be in the ortho clinic doing all the treatment alongside the orthodontist for the cleft patients. And so it was largely handing instruments and putting on mods and chatting to them and booking them in for their ortho exos that we could do. But it was more of a supportive role. So going from that kind of capacity to kind of managing all these really complex patients, it was kind of like zero to 100 in that sense. But in terms of I guess we had a bit of an extended scope working within the Max Vax unit. Like, we would do kind of minor oral surgery and soft tissue biopsies fairly independently, which was something that we were well trained to do. So we always had that direct supervision in terms of upskilling. And we were in theatre, so we had 2 Max Vax theatres a month, 2 dental theatres a month. And in the Max Vax theatres, the consultants, as long as there was enough time on the list, were like, okay, Em, you're doing the whizzies. Here, you can nucleate this cyst. Or, do you want to raise the palatal flap? And there was always scope to kind of in this controlled learning environment, especially in theatre, because it's, I guess, in terms of learning opportunities, if your patient's asleep, they don't need to know that this is the first time that you're doing something. Obviously, they're appropriately consented and it's a safe and controlled environment, but there's someone that has time to kind of hold your hand and give you step-by-step guidance without spooking the patient, I guess. I think in terms of CPD, I guess, because I when you sent me through the questions, I was thinking, gosh, what do I actually have to say? But I have done some courses, but for the most part, it was largely on the job training because we had so many different things to learn that were job specific, and so many people that were willing to help us to kind of progress us procedurally and academically, and point us in the right direction of key papers that we should be reading. And I think that was a nice thing. Everyone was very evidence-based and
No, that's fair enough. I mean, there's a lot there. So, I mean, in your first year as well, you're the Australian Dental Graduate of the Year in 2020, right? Flashback. Okay. So what happens this? Because you're going through COVID at this point, right?
Yeah.
And so you've got this kind of going on, and what's with all these online CPDs? Tell us about it.
Oh, I mean, so in terms of online CPDs, the Australian Dental Grads program did have a couple of things, but it was more like the mandatory training from the hospital that I was alluding to in terms of all the modules and things, manual handling, safe prescribing, all the usual kind of things that you need to work through when you start a public job. But I think in terms of navigating the COVID experience, it was very easy because with my on-call responsibilities, the care that I was providing was considered to be medically necessary. We had a constant stream of patients that still needed their cardiac surgery, so we had to do clearances for them. We had to do all the pre-anti-resorptive workups. We had people coming in, I guess, having deferred their treatment through 2020 and kind of just put their toothaches on the back burner and come in with huge spreading odontogenic infections. Kids were still falling over at home, having their Humpty Dumpty moments. And so there was always something to do. And I think it was actually quite nice in the sense that it wasn't just constant go, booked patient. It was the case of just waiting for calls, doing stuff kind of systematically, giving yourself time to learn the system and talk to patients. And it was actually really nice. And I got to kind of like spend a bit more time getting to know the team, obviously without N95s on. But I think 2021 was the perfect time because we were very promptly vaccinated, felt very safe. And yeah, it was a nice sustainable introduction, and it also meant that with my weekends and after hours on call, I didn't feel like I was missing out on as much socially because I had a bit of structure and purpose to go to the hospital. I was like, yes, give me something to do, please. Yes, it wasn't bad. I think in the second year, when I had more of an established network, things were a bit less COVID-y. The on-call became a bit harder to kind of configure around my life. Well, my life became harder to configure around my on-call responsibilities because obviously that takes priority. But yeah, I feel like I didn't feel COVID as much as perhaps the rest of Melbourne did, and I'm very lucky for that.
It was still normal, hey?
Not completely normal, but we had stuff to do, which was good.
Yeah. So amongst all of this, you're doing your primaries as well?
Yeah.
So I mean, look, primaries is full on, right? Primaries is full on. You're working like hardcore at this moment. So tell us how you prepare it, or how you found the best way to kind of prepare and tackle it.
Yeah, you kind of just got to chip away bit by bit. I was very lucky in that I had a group of friends that had done it the year prior, and so they provided me with a bit of guidance in terms of some of the questions that they were asked and their approaches to study. And yeah, thankfully they'd done very well, and so I took their advice very seriously. I think I kind of just microdosed it throughout the year and just listened to their lectures when I could, wrote my notes and read the textbooks when I could. It was a bit of a slow burn, and I kind of just built up my little like subject Bibles in terms of answering all the practice questions and reading around the topics. And obviously there are some topics that you find intuitively easier than others. I'm a big histology nerd, which I think is a bit controversial because I really like the developmental, embryological kind of side of things. Whereas physiology, which sounds a bit funny working in a tertiary hospital where most of our patients are like systemically complex, I think the physiology side of things maybe doesn't intuitively agree with my brain as much because I seem to overcorrect my negative feedback loops. But really enjoyed the histology, really enjoyed pathology in terms of all the systems reviews from that perspective. Laurie Walsh is an exceptional lecturer. He's very engaging. So the microbiology side of things was quite easy to go through. And then I'd done a molecular biology undergrad, so the biochemistry kind of side of things was good. So I think, it was just a matter of giving myself enough variety, not spending too much time fixating on all the things that I didn't know about head and neck anatomy. But I guess I was lucky from that perspective because we were in theatre with the Max Vax team, and I got to see like biomaxillary osteotomies and orbital blowout repairs and that kind of thing, where you actually get to see all the anatomy exposed once they've done their soft tissue, like I guess they've raised their flaps kind of thing. And so you get a bit more of an appreciation for the anatomy, having seen the clinical side of things, which I think I really appreciated, kind of revisiting the basic sciences, having had a little bit of clinical exposure to kind of solidify things. And it hits differently the second time compared to first year, when you're just overwhelmed by trying to survive and working out what a tooth is. So I think I was very lucky in that I gave work a heads up, took 2 weeks to do the exams, and also 2 weeks before the exam period to study. And so, but also you don't have to do it like that. Like my friend who was studying medicine finished his med exams 6 days prior to the primaries, having listened to maybe half of the microbiology lectures and nothing else. I gave him my notes, admittedly, so I guess he had a little bit of a springboard to jump from, but he got commendations in all of his subjects, having studied intensely for 6 days. So I don't know. I think there's no right way to do the primaries, as long as you kind of commit to enjoying the process and learning the content.
You're just saying it like this. So if I just recap, basically you're saying like the best way you found most helpful was basically starting early and just doing it slow. Because like the hardest part about it is, you know, you're doing a full-time job and then you got to find some time in between. So, you know, here you are, you know, just trying to get through the day, and then at home you're just like burning the slow, you know, the midnight oil, just trying to like churn through these modules.
Yeah, no, I was definitely more of a weekend studier, because I would get home from work and I'm very prone to just like flopping on the couch and taking I was going to say a moment, but a good couple of hours to rehumanize after like a day of feeling a little bit incompetent, or just like running around and not having time for lunch. And I definitely like to kind of take time to decompress on the weekdays and then wake up refreshed, go to Pilates, have a coffee, enjoy my weekends, but just kind of chip away at the content slowly. I think that was my approach to the balance.
Yeah, and then allowing that extra few weeks before the exam to kind of just kind of consolidate it all and prep yourself mentally before diving in.
Yeah, exactly.
Unless it's like your friend, and then he just, you know, just knocks it out in like 6 days.
He's super human though, that man. I don't know. He somehow did it, but yeah, I guess you've got to have that focus if you want to do max facts. So maybe that's it.
Yeah, I mean, you've mentioned a fair few names here and there. So, you know, who's been pivotal in your career path, so far, and you know why?
I do you have, Lawrence?
I've got all the time. You know, just lay it on me.
Yeah, so I think someone that I always credit to kind of plunging me into the hospital space is Daniel Sundaresan. So he was our special needs lecturer, who we're very, very lucky to get. So I think he came to UWA when we were in our third year. So we had him for our didactic teaching in third year. And his lecture style was very unlike any other lecturer that we had. So basically, we just walk into his classroom, he'd put a couple of things on the board, but otherwise no lecture slides, would just have these chats with us, throw questions into the audience. I don't really do well with awkward silences, so I guess I'd answer some of them because I just couldn't take it anymore. He just has the most systematic kind of approach to thinking through problems, and such a pragmatic, and he's basically like Khan Academy for special needs dentistry, I think is probably the easiest way to explain it. And so he was just exceptional, and I feel like he was one of the first lecturers that I kind of interacted with where I was like, yes, this is my thing, this is what I want to be doing. And so we're very lucky to have him in third year. He kind of tutored us a little bit in clinic on Wednesdays. And then going into our final year, when we had our COVID lockdown period, there was no COVID in the community in WA, but the dental school hadn't quite worked out their transition back to uni plan. And so I messaged him and I said, hi, any chance I could come to the hospital and do a couple of weeks of observation? So he said, yeah, sure, bring a friend. So I took along Tom, one of my dental school colleagues, and we did 2 weeks of just running around after him at Fish, going to infectious diseases, MDTs, and kind of shadowing all the visiting specialists. And it was just it was such a good 2 weeks. And I think having spent the first 3 years of dental school thinking, I'm so inadequate, I can't drill this square thing with a round burr. I have no idea. Like, I feel like I'm doing so much for my patients, but it's not showing in terms of outcomes. Why am I here? Why am I so incompetent? What's going on? I think that was kind of the first time being at Fiona Stanley Hospital where I was like, this is my place. I think I can keep doing this. And so I guess, like, touching back on your mention of that award that I somehow came to win, I think it was mainly just because I spent the first couple of years of dental school looking for external pursuits to kind of give me some form of kind of purpose outside of all those little failures in the first couple of years of dental school. So then when I got to Fiona Stanley, I was like, actually, clinical dentistry might be a thing that I can possibly do. So I had a really, really good time at that rotation, and then eventually had another 2 weeks with him. And Tom and I basically sat him down and we were like, Daniel, how can we be you? And he said, well, you should apply to these 2 jobs in Melbourne. He's very good friends with the head of unit at the Alfred as well. And so we had some chats with him, and he was just exceptional. He was a referee that I'm very grateful for. And it was really nice. I was at the RACDS conference last year and bumped into him, gave me a big hug, and he said, when are you applying to training? Can I be your referee? And so almost cried, didn't quite. But he's been a really, really good mentor kind of in the dental school years. I guess someone else that I have to thank as well is Mehdi, who is one of the endo registrars at the time that I was going through training. He was the one that was my little Viva mock examiner, and so we had a nice little symbiotic friendship in that I'd tutor his son year 9 English, and then he'd grill me for case pres. And so he was the one that kept me going, kept me kind of surviving through the exam periods. And then I guess just the extended Monash team as well, all of them were so wonderful in terms of, like, the first time you meet them, they kind of say, so what do you want to do? What do you want to achieve here? And they know where your interests lie and they support that, but also they're always there in terms of teaching and mentorship. And so, I couldn't have been luckier with that job. And Sam as well, our manager in that role. I think I was kind of talking to you before about how she was our little welfare champion and really looked after us. If we ever had a hard day, she'd send us a beautiful text like, hard day for you, and then just send us all these beautiful words of encouragement. So I guess they always say it takes a village, and I've had a pretty good village. There's so many other people as well that have been really transformative, like my research mentor in the US, Rena. So I met her when I was volunteering at IDEA. She was the keynote speaker at that conference because she works in basically the prenatal management of clefts is where her current research direction is going. But there's a lot of genetic overlap in terms of hypodontia and midline palatal development. And so she kind of began working in a slightly different research area, but she is an absolute boss lady. And she gave this talk that was kind of the perfect intersection of my undergraduate research interests in terms of the molecular origins of disease and precision medicine, and my dental interest in craniofacial development. And so I heard her talk, and then at the end of her talk, she wrapped up by saying, if anyone's interested, you can always make contact with me and come and shadow me in the lab. So I went up to her at the conference. We're both wearing pink. I think it was a sign. And I was like, hello, if there's any way that I can come and work with you, please let me know. She said, sure, here's my business card. And then I had the most incredible 2 months with her, and she was such an exceptional mentor in terms of the scientific side of things, but also just in terms of navigating careers as a woman in dentistry, a woman in healthcare. And she was beautiful. Like, she invited us all over for Christmas and was very much our little kind of home away from home, as well as being an exceptionally talented clinician scientist. So we've still kept in touch. Every once in a while she'll give me a ring, and we'll just talk about how I need to go and move to the US and work at the NIH with her, because she's now moved across to DC to work as the director of dental and craniofacial with the NIH. So it's something I'd really love to do, but also now that I've kind of found my passion and drive within the clinical dental space, I feel like that's something that I'm still kind of working out in terms of relinquishing my clinical side of my practice, I guess, unless I can work within an academic kind of like teaching hospital role perhaps, but we'll see. That's probably not for a few years yet.
Well, I mean, like, people would be interested. People want to be interested in, you know, that academic pathway and, you know, what it would have entailed, or, you know, how to kind of get into it. And I think you've kind of alluded to it, which is, you know, just attend one of these talks and they may offer an opportunity, and then you just got to reach out, and then you just got to follow through with everything else that kind of follows.
Yeah, exactly. Like, I think if you find the right mentor that's passionate about sharing in their success and building a strong community of like-minded professionals or researchers, if you're asking the right people, they'll inevitably say, yes, we'll make this happen. We see the potential in your kind of your application or in your approach to dentistry or to research. And if you resonate with these people deeply enough, you're probably going to get the answer that you want. You're probably going to be able to get into these opportunities. So, yeah, it's probably a bit bold of me on reflection to just run up to the keynote speaker. I didn't do it straight away. But she's just so approachable. And I feel like that's also what I hope to achieve as a mentor within dentistry. Like, I've got a bit of teaching through the hospital, which is really lovely because we've got the JCU students up here. So on a Tuesday, they'll come through and I'll kind of grill them in the same way that Daniel used to grill us, and just be like, okay, so what's the significance of this medication and what would you consider from it? And I think they kind of squirm a little bit, but I think they like it. So I think just in terms of mentorship and supporting the next generation of dentists, I tend to gravitate towards people that share my philosophy in terms of wanting to channel a little bit of their learning into supporting the upcoming generation of dentists, I guess. And it's also really nice from my perspective to be like, hey, I've actually learned something over the last 2 years. Let me share it with you. So, yeah. Exactly. So, yeah, I think if you get good vibes from these people and they're warm and approachable, that's the kind of day-to-day mentorship that you want anyway. Like, if you run into a problem in the lab or in the clinic, you want someone that you feel like you can ask questions. And so I was, very lucky to have found that in Rena and in my other clinical mentors as well.
But I mean, like, let's say if I don't do, I've been doing clinical dentistry. I don't have any research papers or anything behind me at the moment, but I want to kind of dive into it a little bit. And how would you go about doing it? Would you say, reach out to, your universities back then, and then just kind of see if you can dive in somewhere? Is that how you do it?
Yeah, absolutely. Yeah, I've got a couple of friends that are doing that at the moment. They're working with the orthodontics department at UWA, I think, because they're trying to see whether that aligns with their clinical interests as well. But yeah, I think they're always looking for people to take on more research projects. And I guess it might be harder. We were quite lucky at UWA in that there was a very strong research to the university's activities. I wonder if the rural unis have as much going on, but there's definitely any of the dental schools or the research institutions that are affiliated with the unis should have dentally related projects. And if there's anything that kind of appeals to your clinical research interests, I would absolutely say send an email, make a call. But I think I always find that the easiest way to connect with people is at conferences. And I think in terms of CPD, I've definitely done a bit less hands-on kind of stuff in favour of going to these big conferences, because I feel like you just meet such interesting people. You can attend such a variety of talks that really inspire you. And I feel like conferences are a good place to make it happen, because often they have less formal social events that are a little bit less intimidating, and everyone's kind of just having some nibbles and things, and it's easier to approach people in that setting. I feel like in person is easier because a lot of the academics are probably wearing too many hats and being stretched in too many directions, so perhaps they're not as responsive to emails as maybe we are, which is completely understandable because of all the pressures that you can imagine that they have placed upon them in terms of teaching and research and clinical responsibilities, and they're probably all working private as well. And I guess that's the trouble with dental research in that a lot of people have multiple responsibilities, whereas I guess in the pure kind of basic science research bases, that's your full-time gig. Like you've got cells to tend to, or you've got mice that you're raising in the lab, and like that kind of consumes most of your energy because you're being paid full-time as a researcher. Whereas in person, it's easy to be like, hello, I have your full attention. You are here on this conference too. Let's have a chat. So yeah, it takes a little bit to kind of hype yourself up, but it's definitely worth it in terms of opening doors for yourself if that's what you want to do.
If you like this episode, drop a comment below on your favorite part or leave a review. Don't forget to share it with your friends, and we'll see you in the next episode of CPD Junkie podcast.